I'm going to try sharing my screen. Just let me know if you can see it, okay? I'm going to try sharing my screen. Just let me know if you can see it, okay? I'm going to try sharing my screen. Just let me know if you can see it, okay? I'm going to try sharing my screen. Just let me know if you can see it, okay? I'm going to try sharing my screen. Just let me know if you can see it, okay? I'm going to try sharing my screen. Just let me know if you can see it, okay? I'm going to try sharing my screen. Just let me know if you can see it. Do you see my screen?
Give me a second. Hari Om, everyone. Hari Om.
Hari Om.
Can you hear me? Dr.
Yes, I can hear you.
You can hear. Oh, okay. This is Ramesh Hegde. I just want to give a quick introduction.
That sounds good. Thank you.
Right. Hari Om, everyone. This is Ramesh Hegde. I'm very happy to introduce Dr. Bijal Bala, one of our own members, who has graciously agreed to give this seminar. I think I would like to give all the time to Dr. Bijal because this is an important topic in the current situation we are in. So she is going to speak a little bit about, give an introduction about this particular project and how she is leading this effort. So without further ado, I will hand over the mic to you, Dr. Bijal.
Thank you, Rameshji. Hari Om, everybody. And just welcoming you to a beautiful day. I went for a walk today and I was really happy to be outside. I'm really appreciative for all of you who have joined today because it's an hour before the usual adult satsang session. So thanks for your time. I reached out to Swamiji a few days ago for this project because it's what we call a citizen science initiative. And for this study or project, we really we need a lot of participation from across people in the state of Texas, if not nationally. But I thought I would just have Swamiji's support and send out an email to our CMDFW members and see if you would be interested. I was very pleasantly surprised and happy to see even more support in the form of, scheduling this 1-hour seminar today on Saturday. So thank you for all the time and for folks who have joined. So I'll just jump in and please raise your hands. I guess you might be muted on your end, but if you have questions along the way, I will try to answer them, but for sure towards the end, I will go through and look at all the questions that you might have typed. So what this project is a COVID-19 symptom tracking study in Texas. And I'm co-leading this study with my very good friend and colleague. Her name is Srila Sharma. We're both at the UT Health School of Public Health. Many of you may or may not know this, but the School of Public Health is part of the University of Texas Health Science Center at Houston, and it has 6 campuses across the state of Texas. Houston is the main and the biggest campus, and we have additional campuses, satellite campuses in Dallas, where I am, San Antonio, Austin, Brownsville, and El Paso. And the School of Public Health in Texas is unique in this aspect that it has a statewide reach. There is no other school in the country that has this kind of a statewide reach. So in this particular case, and in other research that we conduct, we are always leveraging this statewide presence. Srila Sharma is a professor in epidemiology who is on the Houston campus of our school. I am also the dean of the Dallas campus of the School of Public Health, and I can tell you a little bit more about that if you're interested and if you have time. But for now, I'll just get into the study itself. Give me just 1 second. Yeah. So, I don't need to say a whole lot. All of us are living through this right now. The COVID-19 pandemic has fundamentally changed how we live and our way of life. As you all know, it's a novel virus, meaning that no one really has immunity to it. And if you're exposed, we're very highly likely to get it. Its infectious potential is very high. It infects 2 to 4 other individuals from one individual who is already exposed to it. So it's silent, it's stealthy, and it can infect a lot of people. And we are seeing this, right, completely going on and taking over the world right now. So I won't go into it too much, but to say that, I think as of the 18th, 2.3 million cases in the world, of which 728,000 or so are in the US. So we're the epicenter of the COVID-19 epidemic in the world right now. In Texas specifically, if this link works, maybe not. Well, in Texas specifically, we know that now there are several thousand cases. Yeah, I'm sorry about that. The link is not working, and a few hundred fatalities. But it's 453 fatalities. But I think we've been fortunate that are social distancing and mitigation measures, and the fact that we were a little bit later on in the way the epidemic has reached Texas has helped us, and we've started flattening the curve now. I think we've had a few days of fewer cases and a downward trend. However, as you all know, as of yesterday, the governor has announced slow phased opening up of the economy, and that comes with its own set of challenges. I'm having trouble with my screens here. So really, what do we need to do to de-implement mitigation? And I wanted to list some of these things here because this symptom tracking project is one of them. So of course, all of you know, and we've been hearing that we need broad availability of rapid and accurate viral testing, nucleic acid testing, but we also need symptom tracking strategies to target testing in at-risk and vulnerable communities, especially because at least currently testing capabilities are not as widespread and easily available. We also need a statewide system and portal to assess our supply chain for key testing reagents and PPEs. We need to monitor our increase in cases weekly and be ready to de-implement or implement as needed strategies as we're going into the opening up of our economies. And we will likely need this approach until tests are very readily and available, accessible, and are widespread. We have an effective antiviral medication or a vaccine is available. So these are the symptoms of COVID-19. They're very non-specific. As we know, they're flu-like symptoms: fever, cough, shortness of breath, chills, and some more unique ones, such as new loss of taste or smell that we're finding out is important. So this symptom tracking project, jumping into it, why do Dr. Srila Sharma and I think that we need to do this? So we know that symptoms of COVID-19 infection vary widely, with some individuals having infection even without any symptoms. We know that we don't have enough data on the demographic, clinical, lifestyle factors affecting COVID-19, and that the speed of this pandemic and this short interval between exposure symptoms outcomes, the problem of not having enough testing really requires us to come up with a new way that's rapidly adaptable platform to capture real-time symptoms, spectrum of symptoms. Many of you may know, I know there are lots of physicians in our group, that our public health efforts in monitoring or surveillance for flu is based on the number of people who seek services or healthcare services with doctors and hospitals. And in the current situation, we're asking patients who are not, or individuals who are not feeling well, to not come to the hospital and to the doctor, but rather to just call in. And so our surveillance systems that have already been in place that were working pretty well for flu-like symptoms are not working as effectively for COVID symptoms. And this is where we started to think about what's a new way to do that here. And so the COVID-19 symptom tracking in Texas is a surveillance system, and we are going to use it to support and inform public health decision-making for COVID-19 in Texas, and to then also estimate the potential incidence and spread. One of the reasons we think we can do the second bullet of public health decision-making goes back to what I told you about the School of Public Health. We have 6 campuses in the school, and each campus has very strong connections with its communities and health departments, and we work closely with them. So as of now, we have a lot of support from all of the public health departments across the state, where the data that we get out of this project, we would actually share that with them in a de-identified aggregated form, so that if they see hotspots of activities, symptom tracking, they could make the decision to then target the testing efforts, the limited tests that we have to those areas and zip codes. This symptom tracker was originally created by Mass General Hospital and School of Public Health at Harvard. And serendipitously, the UT Health School of Public Health, when we found out about it, we were already thinking along this path, and then there was an app already available. So we partnered with them instead of reinventing the wheel to set up this surveillance. And this partnership is unique because no other state in the country has developed this kind of a strong partnership for this app. What we have negotiated is that we would receive de-identified data from Harvard for the entire state of Texas so that we can analyze it at the zip code level, and also use a lot of our analyst expertise in geographic information systems so that we can further look within zip codes to say which zip codes have people who have higher risk of getting COVID, who have other underlying chronic conditions, that are poor neighborhoods that we know might have additional risk of getting COVID. So jumping into that, the tracker is available on the Apple Store and Google Play. It doesn't take too long. The information to download it is right here. It doesn't take long to actually download and complete. This is sort of how it looks. It takes a minute to report daily, and we'd like people to do it even if you're well, because what it's doing is helping us set a baseline of when people say, I'm feeling well for several days, and if the symptoms then change, we can actually monitor that. And as I said before, it'll really help us identify high-risk areas, people who are most at risk, and also perhaps how fast the virus may be spreading in our areas. And I think more importantly, although 2 weeks ago or almost 3 weeks ago when we started working on this project, most of the country was shelter in place. Now that many states and especially Texas is starting to open up, we see the value of an app like this even more so. So I know this is a little hard to see, but these are screenshots of what you see when you get in, and all it asks for is an email address so that you can set up an account like you would do for any other app. And it takes about 3 to 5 minutes to get through these initial questions, which are really some demographic kind of things, how old you are and what zip code you live in, what's your weight, and then a few questions about your health. And then it says, how do you feel physically right now? And there are a few options. I feel physically normal, I don't feel well. And if you say I don't feel well, it takes you through a series of other questions. So the daily questions, symptoms that it's asking has to do with things like, do you have a fever? If it is, how much is it? Do you have a persistent cough? Are you experiencing fatigue? Do you have a headache, shortness of breath, sore throat? And it's asking through those things. Today, when I did my app, I noticed that there is now the ability to add a profile. So I was able to, for example, add my husband and report for my husband. This wasn't the case a week ago. So the app also with feedback is being continually updated. When somebody says that they're experiencing symptoms, then the app also collects a little bit more data about the symptoms itself. And then at the end, it allows you to share the app with others. So as I said, it's a citizen science approach, meaning that we want all of the citizens of Texas to avail of this app and report their symptoms. So we're working on disseminating the app statewide, not across our campuses, of course, but through that more broadly, and dissemination through local, county, and state level partnerships. And truly citizens share with other citizens. And then there's power in numbers, and we absolutely need data-driven decision-making, which we don't have. One of the things that I hope people appreciate about this is that by having this strong partnership with Harvard and our own state School of Public Health getting the data and that it's going to be used for public health decision-making, that there would be lower levels of mistrust in the use of this app. But as you can imagine, not everybody is trusting of it, and it's okay, because we need a critical mass. We don't need a census. We don't need everybody in the state of Texas, but we need enough. And as of April 13th, I just wanted to show you this. We just launched this app on April 10th. As of April 13th, we had 4,000 participants in Texas. That's not a lot, but in 3 days, perhaps it is. And the dark blue areas that you're seeing are Harris County right there. And this is Travis County and counties around Harris, which is the Houston area, the Austin area, right here, the El Paso area. And this is us here as Dallas, Tarrant, Collin, and Denton County. And the numbers are increasing. We don't have a lot, but we're starting there. And of course, we will expect more of a concentration in the metropolitan areas of Texas. As of this morning, in Collin County, we need 176 more people to complete the app and start using it so that we can get an accurate daily estimate of COVID symptoms. A couple of days ago, when Shrila did this for herself, she sent me a text message because she was really excited because it actually was able to give that 56,600 people had COVID-like symptoms in Harris County. And what this struck us is, of course, not 56,000 people don't have COVID, but even if it's 1% or 0.5%, we're starting to see, and if this number over time is increasing, decreasing, we can see across all the zip codes in Harris County, we can start looking for hotspots. And this Thursday, we also have the Michael and Susan Dell Center for Healthy Living. It also has a seminar where the app developer, who is part of King's College London, Tim Spector, is also going to be there and is going to talk about how this app is being used in the UK, which I forgot to tell you about. The app actually was started and it was used in the UK, and within 48 hours, they had 2 million people who had signed up for the app, and it's being used in the way that I described we want to use for Texas. They are using that in that way in the UK. So we're trying to replicate that process here. So that's what I have in terms of slides. And I really wanted to keep time for questions, discussion, anything you want. But I really would, of course, the whole purpose of this is that I really would like to encourage you all to download and use this app.
Okay, this is Ramesh Hegde again. Thank you, Dr. Bijal, for that informative presentation. So how do we want to handle the Q&A? Rakesh, is there any way we can open up the chat? I think it is open. Do we want to monitor the chat? And
let me see if I can get to the chat. I need to get out of the presentation. Yeah. Chat. Okay. There is a question that says the information. There's a question in the chat box that says the information that we enter in the app, will it be secured? It is secured, and the app developers have, if you go in the app, you'll be able to see what the security policy is. As I said, the data that you enter does not include any personal information. And the data that we receive back from the app developer is completely de-identified, except that we will know that a person who completed this lived in this zip code and then the associated data with it. The next question is, what is the name of the app to search in Google Play? It is COVID Symptom Tracker. It's called, and if you go to the email that was sent out earlier, the link to get the apps, apps is in there. Question, most of the symptoms for COVID reflect symptoms which we come across in some other health issues. How can we identify ourselves that we got infected with COVID? That's an interesting, and that's a good question. The only way to identify if a person has a true infection of COVID is to get tested. But as you probably are hearing in the news, and the CDC recommendation is that if you have fever, shortness of breath, cough, and a certain kind of symptoms that you're supposed to call your doctor, which we encourage you to do, and your doctor can then test you for COVID. What we are trying to do here with monitoring symptoms is that if we monitor over time the types of symptoms that are associated with COVID infection, and if we see blips and increases in that in a certain area, that it can actually help us identify areas that we can target for testing. The app also allows, the app also asks people if you have been tested for COVID and if you've had COVID. In those cases, the information about the person, not specifically who you are, but what kinds of other diseases you might have or how old you are, can help us better understand the epidemiology of COVID. Okay, I think it says, thank you for the presentation. You're welcome. And it appears that somebody had multiple apps but was able to figure it out. That's all the chat questions. Are there other things?
Can I ask an audio question? Can you hear me?
Yes, please.
So my understanding is, this is Raghu, Hariom. My understanding is identifying hotspots and people that are infected has to be coupled with prompt testing and isolation or quarantine. Yes. So I don't see that concerted effort or aggressive testing effort going on here. So how are you completing the loop here?
Right. So it's such a rapidly shifting landscape, right, Raghuji? So I can give you example regionally. So for example, in Dallas County, we are working directly with the Dallas County Health Department, and they are also, I know for a fact, are ramping up their testing capability as well as their contact tracing capability. And in fact, a lot of my master's in public health students from the Dallas campus are now volunteering for the contact tracing efforts. So we're not seeing it in the news as much, but I know for a fact that they're trying to ramp up. It's not nowhere close to the level we needed, and that's unfortunate, but I believe that it is going to get ramped up. I think the other thing that they are, the Dallas County Health Department, I think even statewide folks are trying to do is, because of the underfunding of the public health infrastructure, our contact tracing effort is really archaic. It needs to come into the 21st century. It needs to get electronic. There are still places where a PDF form is being scanned and sent to the health department for contact tracing. So there's a lot of that work going on as we speak at the health department levels. As part of this project, this project does not have the scope to take that into consideration, but we can take the results of hotspots to Dr. Phil Wong, who is the Dallas County Health Director, and say, here's an area in Dallas County, or here's an area in Collin County that we think we need more testing in, and we hope that that will happen. Sorry.
Yeah, this is Ramesh.
I'm looking through. Yes, please go ahead. I'm also looking through questions here at the same time.
All right. Yeah, I think there is somebody who is asking a question now. But my question is, I know you have talked about the app and how we can use it. One of the ways we can help is to download the app and use it, right? Other
Yes.
than that, are there things that we can help advance the use of this app? Is there anything else we can do?
So we absolutely, please share it as, put it on your social media and your social network connections, because the broader we can get its reach, the more accurate our estimates are. You can imagine that if we have only 100 people in Collin County, we don't have as much confidence in the data we get out of that, as opposed to if we can get a lot more of them. So one way you can help is to disseminate and disseminate the app amongst your networks, for sure. If you're also asking what other kinds of efforts our Chinmay Mission community can be involved in, There are many things that come across every day in COVID efforts, and I'm very happy to compile that information and bring it to you to see where the community can be more helpful. For example, there has been, I mean, I know that we do a Diwali food bank, North Texas food bank effort, and the food bank really, really needs help at this point. I think the challenge is to keep the volunteers safe as well as to be helpful at the same time.
Hariom.
Hariom.
What if our PCP is not open? Is there any other contact available in case if you identify the symptoms?
That's a good question, and I need to look it up and send it to you. A little while ago, the Department of Health was open for questions, but I know that that's not happening anymore, and they really want you to go through your doctors. The one place I know and again, things are shifting so fast, but the Baylor Spot and White location in Plano had a drive-through testing service, and you can, again, they have an app that you can download, and they'll say, how are you feeling? What are the symptoms? And then they'll say, come on this particular day if you need to get tested to the drive-through service. But almost every day, there are new testing locations that are opening up in our area and in our neighborhoods.
Oh, thank you.
So there's a question that says, I felt shortness in breath and felt dull for a couple of days. After a few days, I'm feeling good and better. I approached the teledoc and told me that I might have COVID and I might have antibody as well. Is that true? Based on just those symptoms, there is a possibility, but you wouldn't know until you get tested for COVID itself. So I definitely think that if you're still not feeling good, that you should get tested for COVID if you can. And this is a great example of perhaps what's really going on and what we are worried about, that the true incidence of COVID is unknown to us because of the very limited COVID testing that's out there. And if the testing capabilities and infrastructure improves significantly, and if through the use of this app, more people can get tested if they have symptoms for several days at a time, we can start really getting at what the prevalence of COVID is in the community. And that definitely will give us more confidence in the strategies we are trying to put in, the strategies that we're trying to actually de-implement as we go forward. Another question.
Bijal,
yes.
There are 4 or 5 questions that came through the chat. I don't know whether you can.
I'm looking at it. So let's go through them. So
okay.
Texas is opening up in phases. Can we still follow staying home or can we go out? Yeah, absolutely. If you can, you should stay home, in my opinion. And of course, if you're at any of the high risk groups, even longer, I would suggest you should stay home. I think that the opening up in phases is really to relieve the pressure on the economy and people who have to step out and go out to work to make a living. But people who stay home, who can stay home, if they do stay home, it will help continue to keep the curve flattened, as you all must have heard. How was this used in England? So this is what we have. I don't have an answer to this right now, but I will have to make the recommendation to go to our webinar on Thursday. And it's in the slide deck, and I'm happy to share this slide deck also with Ramesh ji and have it sent out to everybody. The reason is that we've asked Inspector to really show us some data and show the application of how this app is being used in England. The other thing I want to point out here is, in response to this question, is many of you may have heard that in other countries like Singapore and South Korea, where the COVID response effort has been much better than other parts of the world, there is constant tracking of symptoms. For example, I know I have relatives in Singapore where before they walk into a gym, they're tested, they are scanned for their body temperature. And that's just a way to try to get a handle if there is even some symptoms. It may not even be COVID, but we are being extremely careful, and that's what they're doing over there. Hari Om, will you be able to share your slide press? Yes, for sure. Happy to do that. And I do believe that this presentation is going to be on CMDFW's YouTube channel. If someone is suspecting to have COVID, whom would I consult and where would I go for treatment? You would have to go through your doctor, and they will refer you for treatment appropriately. Not sure if I have this, if you have this info, any idea how we can get antibody tests. And I do not have this info. Currently, I know that UT Southwestern is working on a pretty big effort to do antibody tests in several Collin and Dallas counties, but that is a very new initiative, and I don't know exactly when it's going to get rolled out. Are you working with the CDC or other guys so that people have more trust in this app in terms of personal data assurance? That is a very good question. I'm not directly working with the CDC, and I'm not directly working with any government agencies, but as I said, we have a pre-existing relationships with county and state health departments where they, in several places, have also agreed to send this app out. And if you want some more information, the website, again, that is in the presentation and other places, there's more information about the app. And I completely understand that is such a legitimate question. You know, there is a proliferation of apps and app-based things out there, and we have to be very careful about our own privacy. So please, I encourage you to read all the information and make a sound decision for yourself. Have we reached peak yet in Texas? Based on the latest information that I have gleaned, we're expecting peak to be the end of April, the beginning of May. So the answer to that is no. We have not yet reached peak in Texas based on the latest modeling that we have. And it'll be very critical for us to monitor what this phased opening up, the effect of that will be on new cases of COVID, partly because the opening up itself may increase cases, but at the same time, our testing capabilities getting better. So that also, just because we'll be testing, we'll also be seeing more cases. So I would say in the next few weeks, 2 to 3 weeks, you'll still see a continual uptick of cases in the Texas area. And as many of you know, that Dallas County and Harris County are the two big hotspots in Texas. So I think the questions have slowed down. Does wearing masks help? By the way, I have to say, it's amazing to do this thing. I've never done a presentation like this where, you know, it feels like the Facebook Live approach where things are popping up. So I appreciate the new experience here. Does wearing masks help? You know, as long as you're outside and going to a grocery store, having some sort of a barrier does a couple of things in my opinion. This is I don't think that it's very rocket science kind of a thing. I like to wear a mask because I don't touch my face and my mouth and my nose as much directly. So when I go to the grocery store to shop and things like that, having a mask prevents me from touching something and touching the same hand to my face. And of course, if you happen to be in close proximity to somebody who has it, at least there is some barrier to the spread of that, of the virus. Any information when vaccines may be available? We know so far there's no vaccine yet. Yep, no, I believe it's 18 months out at the minimum. I'm sorry, I don't have any better news. And I would say that if we have a good effective vaccine in a year to 18 months, that would be the fastest turnaround on vaccine development that I've ever encountered. So. Does taking HQL or chloroquine help? There is no evidence, Vijayji, of any of these, any drugs currently helping. I think it's more anecdotal. I think people somebody may have told somebody that it helps, but from a research perspective and from trials perspective, there are trials that are ongoing looking at whether chloroquine helps or not, but we don't yet have any evidence that it does. Do you recommend washing hands and cleaning surfaces frequently, even if I don't step outside of the house the whole day? That is a very pragmatic and good question. I would say that that depends on how much activity you have from the outside coming in. You may not step out, but if the children are stepping out, if your spouse is stepping out and coming back in, so I think that it's definitely helpful to wash hands and clean surfaces frequently, because I think it's very hard to control what the transfer of viruses and dirt and germs from inside outside, because there's usually a lot of activity of lots of people going in and out. How can we help physicians and healthcare workers who are on the front line? We're all staying home and that helps, but what are some of their needs that we can address? That is a good question. And I have also been trying to do this, and the needs are changing as we go. It depends on what communities you're connected with. I know for a fact that lots of frontline healthcare workers have trouble with childcare, and if they have to work, who's taking care of their children? I think that's a real problem. I think that in addition to the ones when we say frontline, truly taking care of COVID patients, we're also slowly going to have an influx of healthcare workers who are going to get back into taking care of the usual things, people's diabetes and hypertension and children's well child visits. And so what are their needs? Do they have masks and PPE? And so if you have any connections to get any of those things for them, that would be great. But staying home helps. These are all really great questions.
Okay, I think I don't see any more questions. Bijalji, thank you again. From the type of questions, the number of questions that came through, you can see that the audience is quite engaged. Obviously, this is a timely topic, and I'm really happy and thank you for presenting the information, presenting this initiative, so that all those people who are involved and in their network, they can share this work. And again, for all of you who are watching and listening, if you have any additional questions, Bijalji's email is given there on the screen. Feel free to contact her. And again, we'll make this presentation available.
Thank you so much. I absolutely appreciate it. I'm hoping that tomorrow Collin County will see a number there instead of 166 more cases needed. Thank you. I cannot express my gratitude for the support of CMDFW. As I've said, my children have been going there my son is now 14 and has been going there since kindergarten, and my daughter is 10, and it's been an amazing influence on our children, good influence on our children. So thank you so much for this opportunity.
Excellent, thank you.
I'm going
Hari
to
Om.
Hari Om.
Hari Om. Okay, with that, I think we can close this.